everyone, welcome to my channel. Here we deal with your dental health concerns and help you maintain a good oral hygiene. I have always been asked by my friends and relatives that do you really need to do a cleaning once in 6 months? As most of the dentists advise them to get a cleaning done like that. So does it really help you? So the answer would be that it differs from each individual to individual. So what is this cleaning? Cleaning is basically a procedure, also called as scaling, is a procedure which is done by your dentist in the dental clinic in order to remove those deposits which you see as yellow things stuck on your tooth. These yellow deposits are also called as tartar or calculus and which get deposited on the tooth surface over a period of time. It happens for everyone. Okay, so for each individual, the time taken for this deposit formation differs. It can depend on a number of factors like the kind of saliva you have, the way your teeth are placed, that if there is any hormonal changes, or it can even depend on the bacteria, the kind of bacteria which are present in your oral cavity. So it depends that for me, I require a cleaning once in 2 years also because I don't get those deposits. Maybe my teeth are positioned in a very nice way. So for maintaining a good oral hygiene, IDA also recommends that you get a cleaning done once in 6 months. So when you do that, it helps you have a good healthy gum tissue which will help to hold the tooth together. So how do you know that it's time for you to get the cleaning done? You might start noticing some sort of yellowish discoloration around your tooth. Then some of you might have bleeding from the gums when you're eating an apple or maybe when you're while brushing. Or some of them have no symptoms at all. They just have thick deposits under the tooth, sometimes under the gums which are not even visible outside. Sometimes you can also have bad breath, then maybe you can have some sort of taste difference in your mouth, and sometimes some of them even get those small deposits broken when they bite into something very hard and they mistake it to be a part of your tooth. So all these does not happen in general. With most of the patients, this goes unnoticed. That is why it is recommended that to have a very healthy oral hygiene, you definitely need to get a cleaning done. And if you can do it at least once in a year, that would be a very ideal condition for you. So now, who are those candidates who definitely needs to get this done once in 6 months? Ideally, your dentist is going to inform you about the gum problem that you are facing. So if you are somebody who is very prone for gum diseases or those who have already undergone a gum surgery, for them, the tartar deposits very much faster compared to other people. So they need to get it done once in 6 months and sometimes even once in 3 months. Other than that, when it comes to patients who have braces, it's very difficult for them to brush, as well as those patients who have crooked teeth. I mean teeth up and down, here and there. So those patients, they need to get a cleaning done because tartar deposits are not something which you can remove with your regular brushing. And over a period of time, as it builds up, it will harm your gums. And you know what is the worst? Having deposits in your mouth will never cause any problems in your daily routine. Neither is it going to be a painful condition. So what happens is most of the time we tend to ignore, and over a period of time the damage becomes so much that it becomes irreversible. So that is why a dental cleaning, a professional cleaning is definitely recommended for you. Some of them also have a doubt whether cleaning should be done for children. Yes, of course it can be done. Especially there are some children who actually do not brush well at all. So even they have these deposits formed. Maybe not like us in that large quantity, definitely they will have. And even if it's the child's gums, it needs to be protected, even though it's the milk teeth around which these deposits are formed. So doing dental cleaning for children doesn't really cause any harm to them. Please remember that having a very healthy set of teeth is not enough. Having very strong gums in order to hold the tooth is also equally important. Please like and share my channel and subscribe to this. And if you have any doubt, please do put it in the comment section so that I can make a new video and clear your doubts. As well as, I will be doing a video on how are these deposits formed on the tooth surface. I'm sure that most of you must be having a doubt that if you do a cleaning once in 6 months, is it going to remove a part of your tooth as well? Let's clear all the doubts in my next video. Please like and subscribe. Thank you.